we go. Okay, today I'm going to lecture on ethics and healthcare workplace violence. As you notice, I have kind of in the corner here, ethical hacking. This will I won't cover, but um, ethics is also a part of HIPAA, and I'm sure you guys have heard quite a bit about HIPAA. Um, and I just want you to know that um, HIPAA practice falls under uh, legal ethics, and a lot of um, facilities, because of HIPAA practice, nurses have lost their license, or not license, have lost their employment as a result of probing into charts when they should not be. So here's an overview of this lecture. This to carry out professional duties requires understanding legal and ethical terms and definitions. Understanding that dealing with ethical issues as a professional may challenge a person's personal beliefs and moral structures. I will integrate the workplace violence and how those will challenge your personal beliefs and moral structures. Nurses must follow many types of laws and legal practice to maintain their license and practice safe and quality care to patients. This is, you have in your resources, the scope of practice. I will have not many, but made a few questions on the scope of practice on the quiz. So make sure that you do review the scope of practice for nursing. Okay, so we've got with between the two of the topics, we have PLO 1 and 3 with the student learning outcome number 8. Nurses are privileged to be licensed, but that license comes with legal responsibility. Okay, this is our student learning outcome to describe the responsibility of the professional nurse to practice within the legal scope of practice and to uphold the code of ethics set forth by the profession as defined by the American Nursing Association. Okay, so let's dig into the ethical and moral issues. Healthcare professionals may be confronted by many ethical and moral issues that challenges their personal belief system. Moral and ethics are similar in that they relate to right and wrong, but they are different in definition. Here is just some things to think about, moral and ethics. A patient recently grabbed a nurse in Georgia by the wrist and kicked her in the ribs. Does the nurse kick the patient back in the ribs? Ethical, moral? A nurse in South Dakota was thrown against a wall and was bitten by a patient. Does the nurse punch the patient in the face to get him to stop biting her? Ethical, moral? A medical student in New York who came from Thailand was called China virus, kicked and dragged to the ground, leaving her hands bleeding and legs bruised. I always kind of feel like I'm a person first. And as a person, would I tolerate this? But I get my license and now I'm a nurse. And do I have to tolerate this? Ethical and moral issues. Ethics. Ethics are our individual belief system. That's where I kind of come in and say, but I'm a human first. I am me, Brenda. Where do my ethics start, end, and then I become a nurse? My individual compass. Brenda first, nurse, where do they come in? Right and wrong. Would I go to the grocery store and let somebody hit me and I not hit them back, but yet I go to work and I get punched and hit and bit? Where where does that ethics come in? I'm going to figure out how to stop sharing, and I'm gonna have you watch 2 videos just to kind of reinforce this, um, point that I'm making. I'll make sure I'm showing you the right one. WHF. Bear with me. WHF. Make sure I'm W. Okay, so that's not it. Okay. Okay, so let me share this one with you. Share. Okay. All right. Can you see this? Okay. All right, so let's play this.
Being in critical care, it's a very high stress environment. You know, we're often with patients and families on their worst day or during, the worst period of their life. That's a very stressful time, and we understand that. But definitely, I had, been punched, kicked, arms grabbed, verbally assaulted. Sometimes, as a nurse, you want to care for these people, you want to nurture them, so you think, well, they didn't really mean it, or they're coming out of anesthesia, or they're really sick right now. But at the end of the day, it's not right. It's not okay. As we were attempting to give him this medication, he grabbed my right arm, and then in the sort of scuffle, he was able to get a hold of this syringe. The plunger had come out, so the medication was, on the floor or something. And of course, the needleless adapter didn't detach. The cap actually came off. So he had a weapon now. And that's exactly what he said. He had a hold of me. I was very close to him, probably at one point within 2 inches of his face. He is verbally very aggressive. He's screaming expletives in my face. And he now has this weapon, and he says, "This is like what they use in prison to kill people. I could kill you right now." And I mean, it's still hard to think about that. I know I'm smiling now, but that moment was, I mean, everything stopped. I was scared for my life at that point. I remember hearing that security said that they couldn't intervene, that they weren't allowed to touch the patient. And at the time, I don't know what I was expecting, but I was at least expecting the hospital security to come to my aid and to separate me from this individual and to bring me to safety. So in the weeks that followed, we did what's called a root cause analysis, an RCA. I clearly remember the risk manager say in that meeting, "I don't get why we're even having this RCA. This happens all the time. At my old hospital, we wouldn't have even, batted an eye to this, that this was not something that warranted this level of a response." And I was pretty adamant that he was coming back. He was coming back to receive medical care, and we should know better. I worked really hard to become a nurse, and I loved it. I was good at it. And, especially now with the COVID-19 pandemic and the amount of physical and emotional stress that our frontline healthcare workers are under, I think it's really important to be talking about this because we need to protect them. And, I feel bad that I can't, sorry. Um, I feel bad that I can't be standing side by side with them and helping them. And that was taken away from me, you know, so
That's pretty painful. That's pretty painful. Who am I? Um, that still kind of grips at me. We work hard to be a nurse. We want to be a nurse the rest of our life, and all it takes is one horrible person to injure us and cause us to lose our dreams of wanting to be that nurse. Here's another, but to me, that's more of our individual belief system. Here's another one on right versus wrong. And this is another reason why, oh, I probably am not sharing, but let me go right to the video. Um, Let me figure out how to stop sharing over there. And let's move right over to this next video. Let me go right over to this next video. Can you see this, The Guardian? Okay, wonderful. Let's go. And this one I want to set you up for as far as right and wrong and why you are a supervisor and why you supervise your ancillary um, uh, personnel. And so let's do this.
Oh, don't do that. I don't do it on my face. It's like, what am I going to say? I'm doing it myself. I'm doing it, Mum. No. You're not saying it. You're not doing it. Are you ready? Yes. Come on, stand up with me. I'm hanging up. I'm on the floor. I'm on the floor. I'm on the floor. I'm still on the cruise. Oh, the cruise is shit. Don't do that. It's the wave. Oh, that hurt me. Maybe I don't know what I'm doing. I don't know what I'm doing. What am I doing? Thank you. No, I don't know what I'm doing. Help me. No. Who are you? Who are you? Who are you? I don't do it on my face.
Okay. Let me start sharing the PowerPoint. This is the one. Yeah. Okay. As oh, I'm sorry. Hold on. Oh gosh. Ah, am I struggling or what? I think my hold on. Let me stop sharing. Okay. Hold on. Let me go back. My computer is on overload. I think it just doesn't want to behave. Let's try. Okay. Can you see? Okay. I share those two just to kind of go into violence against nurses and your own individual belief systems on ethics and the right and wrong, be it yourself or be it others, but the importance of supervision is kind of, from the very beginning. When I asked you, are you a leader? And we talked about being a leader at the bedside and the supervision. And that's just a wonderful example of why you need to make sure your patients that you're responsible for are getting the high quality of care that's needed. Okay, and so we'll talk about the code of ethics, that we all are, we work under. Those were, no matter what state you go into, um, you will be expected to practice under those scope of practice and or the code of ethics. We have our scope of practice, but we also have our code of ethics, and it's important that you know the code of ethics. And I have 2 slides, and I will encourage you for the exam to know these code of ethics or working definition of the code of ethics. Healthcare professionals cannot provide attentive care when they are afraid for their own personal safety, distracted by disruptive patients and family members, are traumatized by prior violence interactions. Just to let you know that there is federal legislation that's out there that was started in early 2021. The House of Representatives, they passed it, HR 1195, the Workplace Violence Prevention for Healthcare and Social Work Act. It passed with bipartisan support and is now in review by the Senate Commission for Health, Education, Labor, and Pension. Among other measures, the bill requires the Occupational Safety and Health Administration, OSHA, to create enforceable safety standards by 2025. The AACN has joined this and supports this HR 1195, as well as the American Nurses Association. The AACN, their position on it, educate staff on how to recognize the potential for violence and how to de-escalate, to report structures for workplace violence with ease, to understand policies and procedures on how to report violence, press charges against persons who assault healthcare, support programs for employees to help them cope with these violent attacks and incidents, ensure the presence of sufficient security system, alarm, and security personnel. I wanted to just highlight a little bit about pressing charges. Yes, it's a process. We did talk about, appearing in court, depositions. We talked about that last week. It is important to press charges because if they do it to you, they're going to do it to somebody else, and they have to be stopped. They have to be stopped, and it's time consuming. Maybe it's not time consuming. Who knows? but consider pressing charges. Another point I wanted to stress about the security personnel. In her video, she was saying the security couldn't touch the patients. Find out if security can touch the patients. At Palomar, security can lay hands on the patients and they can restrain them. So do make sure wherever you work that security is, can touch the patients. That's very important. Okay. What the American Nursing Association says about workplace violence, they would like to see implemented establishing and exchanging penalty for assaults on nurses and allowing healthcare workers to use only first name on identification badges. That is implemented at Palomar. I've had incidents where patients have, angry, or the family members are angry, and they'll say, "What is your name?" And then they'll, "Oh, it's Brenda." And they'll, "What's your last name?" "I'm not giving you my last name. My first name is Brenda. That's it. I'm not giving you my last name." And don't. Because all we have to do is surf the web and find a couple of Brendas and come stalk you at home. So do not give them your last name. And the ANA also says requiring employers run workplace violence prevention programs. This is real. This affects our ethics and our morals. I mean, next time you may want to punch that person. So we need outlets. So, of course, who's opposing the cost of HR 1195? The American Hospital Association opposes this bill. Why are they opposing it? Due to the cost. It's a crying shame, but that's why they are opposing that bill. That's terrible. Okay, again, a little more in-depth detail definition of ethics, the branch of philosophy that examines the difference between right and wrong. Again, review the definitions between the ethics, bioethics, fidelity, veracity, benevolence, non-malfeasance, justice, and value clarification for the quiz. But the 3 reasons too for not reporting violence incidents. Make sure you know that nurses won't do it because of fear of retaliation. Don't give your last name. Lack of clear reporting methods. Belief that nothing will be done about it. We have to do something about it. We can't let that continue. So again, this is one of those lectures that we wish we can do it in class. I do have case studies that was integrated into this lecture. But in the meantime, I'll let you look at this video showing a doctor, and I'll let you ponder over it. I'll stop sharing and I will share this video. And your video.
Usually bras fit small-chested women.
Gapping. You guys, look.
There we go.
You don't see this a lot, an angry confrontation between, of all people, a doctor and his patient.
Go to the ER and wait for 9 hours.
Okay, you can get out of her
out of my office.
I will
now.
Jessica Stipe was suffering from a severe case of the flu and waited 1 hour and 15 minutes as her symptoms grew worse.
I made an appointment at 6:30 because I knew that
It's
being out of my bed
7:45,
an hour
and
and 45 minutes.
We've
and I
already
have
been
not
working on you. We've done a
came in,
urine test on you. I've seen you.
You came in and said, I'm going to check your pee.
Does that take 3 seconds, you think?
I don't know how long.
Do you want to be seen or not?
I want to go home and get in my bed. I'm
Then
miserable.
fine, get the hell out. Get your money and get the hell out.
I did. But that
See you
right
later.
there is
I'm livid. I'm livid. And it's not even, you know, it's the way he spoke to us that was completely unethical and uncalled for.
Jessica's 16-year-old daughter, Courtney, recorded the drama at an after-hours medical clinic in Gainesville, Florida.
You can get out of her.
Out of my office.
I will
now.
file a complaint with a Better Business.
Mom, I got it on video, so it doesn't matter.
Go.
And my
What's your
daughter's
daughter?
recording this. My
What's your
daughter is
name?
recording this.
You're recording this?
The doctor grabs the phone right out of the daughter's hand.
Give me my phone.
I told him my daughter's a minor and I'm calling the police. I did dial 911 at that time, and he stopped my daughter's recording and threw her phone back down the hallway and cracked her screen.
We do have these witness statements that I know you know about from people who were also there in the doctor's office. They're saying that you were using profanity, not speaking nice to the doctors, threatening the staff.
None of that is true. Like I said, the video is the only real altercation that ever transpired.
Dr. Peter Gallagly says the patient was belligerent and abusive to the office staff. Still, he apologized, saying in a statement, "I regret losing my temper and speaking to the two women in a manner that is not befitting a medical doctor." We showed the video to ER doctor Jake Deutsch.
I think that that goes beyond what is considered acceptable in all standards. Certainly losing your temper is one thing, but using profanity and then having an altercation by hitting the phone just shows a total lack of control.
Then fine, get the hell out. Get your money and get the hell out.
I did.
Okay. Again, ethics and our morals. There's a line of demarcation. There's a line of we're a person first. Boom, we're given a license. Then we are licensed to behave. And how that we can tip that behavior and become irrational. Our ethics and moral are always being tested in this profession. I'll let you go over these case studies. There's different ones to just ponder over. Did Susie violate the ethical policy? What ethical principles might play into this practice? I'll let you do those on your own. Some legal terms that you can review. Do not resuscitate. It's written by the doctor. Durable power of attorney is an authorization that enables any competent individual to name someone to exercise decision-making authorities. Informed consent, person agreement to allow someone to happen based, words missing there, on the full disclosure of facts needed to make an intelligent decision. A person basically is informed. Okay, a person informed consent like a surgical, that they are informed, full disclosure of what's going to happen to them. In both of these situations, they have to be competent. They can't be, how can I say it, like dementia or under the influence of drugs. And in this one as well, they cannot be under the influence of of drugs. They have to be competent in order to sign a consent. Know the difference of assault and battery, even if it's on a cell phone and you break the screen, you can't do that. More legal terms, false imprisonment. There's a thin line between false imprisonment, That's why you don't see the type of restraints that were used many years ago. We did a lot of imprisoning patients and tying them to the bed so they couldn't get out. Can't do that anymore. Falsification of records, that goes back to HIPAA. Looking into records that you're not allowed to look into. If an actor comes in the hospital, or the president of the United States comes into the hospital, don't go near that chart, because IT is going to have major radar on everybody who touches that chart. If you have your own personal chart, you're seen at that hospital, do not go into your own chart. You cannot. HIPAA prevents you from doing that. You cannot do that. Invasion of privacy. Yeah, you've got to follow HIPAA rules and don't violate them. You can lose your job for doing that. Unprofessional conduct and versus whistleblower. The difference between the two. I probably won't test you on this. I'm more than likely won't, but it's just important to know. Unprofessional conduct that could adversely affect the health and welfare of the public versus a whistleblower. You're reporting a conduct that is incompetent, illegal, or unethical. Be careful about doing this. People do it. They do it all the time. But a hospital may terminate you. That's their right. Being a whistleblower, and it's not that they're going to terminate you as a result of being a whistleblower, but they'll find a lot of other reasons to terminate you. But I don't think legally they can terminate you for being a whistleblower, but things happen. Case studies, again, just a few more case studies that we would have had an opportunity to discuss in class. Please go over those and just ponder over them. Because again, I will test you over those definitions. Okay, we've talked about the scope of practice, the ANA code of practice for professional nursing. This is just informational about when it was first introduced in 1950. It's underwent multiple revisions. In 2008, they added the codes of interpretive statements. They continue to be updated and revised. And the Nursing Code of Ethics currently 2015. The ANA believes that the Code of Ethics of Nursing is non-negotiable, that each nurse has an obligation to uphold and adhere to the codes. So don't play around with the Code of Ethics. This is just informational again, because I believe that we are of a nursing profession, and I believe, my life has been nursing, and I'm dedicated to my life as a nurse, even as in my days when I do retire. I will always believe in the Hippocratic Oath for nurses, the Nightingale Pledge. We're in certainly the modern version, but just informational. There's three versions. And when I say three versions meaning the Nightingale Pledge started in 1893. And it starts out, I solemnly pledge myself before God in the presence of this assembly. But within that pledge, I'm trying to read, says, with loyalty will I endeavor to aid the physician in his work and devote myself to the welfare of those committed to my care. Well, in 1935, they came along and revised the pledge to pretty much start off the same way with the same clause. With loyalty will I endeavor to aid the physician in his work, and as a missioner of health, I will dedicate myself to devote service to human welfare. So the Modern Practice Nurses Pledge. With this pledge, wow, this pledge hasn't drastically changed. Many nursing schools that still uses the nursing pledge have made updates to the earlier versions. And one change has made specifically to remove the phrase loyal to physicians, to promote more independence in the nursing profession. So now the clause with the previous phrase about the physician, now it says to co-op faithfully with the other members of the nursing team and to carry out faithfully and to the best of my ability the instructions of the physician or the nurse who may be assigned to supervise my work. The operative word, to instructions, to the best of my ability. So that now gives us that independent thinking. We are not loyal to whatever the doctor says, whether it's right or wrong. We're going to follow you and jump off that bridge. We are going to be able to say, doctor, I'm not going to administer 100 milligrams of insulin. I think that's too much. I don't believe this patient whose blood sugar is at 70 and has been running between 70 and 120. I'm not going to administer 100 milligrams of insulin. We are now working interdisciplinary, and now we, to the best of our ability, we are able to be thinking, critical thinkers, and we were able to work with that doctor based upon his instructions and do what's best for our patients. So that's what the major difference of the Nightingale Pledge now says. So there you go. That's history. That's ethics and workplace violence. I hope you've enjoyed the instructions. I'm sorry, the lecture. And that's just about all that there is now. And I'm going to stop the recording if I can find it.